Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me is Dr. Craig Stern. And today we're going to talk about healthcare, whether it's a right or a privilege. And this has been a debate for decades. Usually it tends to get a little political, but we're going to stray away from that and focus more on the ideology. Should healthcare be a right of every citizen or a privilege? This question came up recently while we were reviewing the Bernie Sanders bill for Medicare for all, and also the Graham Cassidy bill, which is the Republican version for repealing or replacing the ACA, Affordable Care Act, also known as Obamacare. And we're not going to get into what Bernie Sanders has or what Graham Cassidy's bill shows us, but more about whether we believe or not. It's not an opinion based, but whether what happens when it's a right or what happens when it's a privilege, and how other countries are handling their healthcare. First question, Dr. Stern. Let's say that as Americans, we all believe that it should be a fundamental right. What would this mean?
Well, if it's a right, then that means that everybody gets at least a standard level of health care.
Right.
It means that they get care that includes hospital coverage, emergency coverage, ambulance coverage, ambulatory care coverage, drug coverage, etc. So everybody gets it, right? They may not get to the top of the level of care, depending on what that care means and whether they have the problem that requires it.
Right.
But everyone gets care. That's true. Now, having said that, there are already people that are getting it in the United States and certainly across the world. Across the world, outside the United States, it's considered a Social Security benefit. So everyone gets it. It goes into the cost of running the country.
Right.
And therefore the taxes and everything that are apply to everyone being able to get it, whether they are sick, whether they're not sick, whether very sick, or otherwise everyone gets it. In the United States, it does exist in some areas, namely Medicare, which is a federal program, Medicaid, the S-chip program for kids. These are programs that are already going on with regard to that. So there is certain things that are right within the United States that fit that mold.
Right. Okay. Well, in contrast, let's go with no. Let's say every American believes that it shouldn't be a right. So what does this mean?
Well, if it's a privilege, then the question is that everybody has the opportunity to sign up and buy health insurance or not.
Right.
If you buy health insurance, you have the right to buy health insurance at any particular level, meaning something that covers a lot of things in a gold plan, some things that don't cover a lot of things, but it cover minimal things in a bronze type plan.
Mm-hmm.
And everyone has an opportunity to do that. The main argument is that government is not involved. Individuals are making the decision.
Mm-hmm.
And that individual decision is based on who is in charge of their own health care.
Right.
The difficulty that has come up with that is that suppose that I'm a person who decides not to buy health care.
Mm-hmm.
It's my choice. I chose not to, but then I get into trouble. I get sick. I have an emergent condition. I get appendicitis and I need emergency surgery. I get cancer, God forbid, or something else. Now, because I didn't buy it, now I'm going to be using resources. I'm going to be using hospital sources, emergency room sources, doctor sources, certainly drug sources, etc.
Right.
And now everyone's going to pay for it because all of those who have bought healthcare insurance, their premiums will go up. Certainly it may lead to taxable issues where people have to pay more taxes in order to cover it. So not arguing the political problem is there's a fundamental problem, and that is what do you do about the people that haven't bought healthcare insurance?
Right.
The other part of this is, and you've talked about it going on for decades. Actually, it's gone on for hundreds of years, where there have been issues philosophically
Right.
about whether healthcare is something. There's been arguments, well, healthcare is not included in the Constitution. Clearly not, right?
Yeah.
However, the framers of the Constitution didn't go after things that could evolve over time. Alexander Hamilton in the Federalist Papers talked about the fact that there was going to be a dynamic document of the Constitution, things would change, and people were going to have to change with it. So irregardless of how you feel about everything, the fundamental question is that people do have the choice, they can have the choice today.
Mm-hmm.
And as a result of that, younger people who have not bought healthcare insurance because they're healthy and don't have a problem, if they break a leg or they get, God forbid, some other medical problem, then either they're going to have to pay for it or the rest of society will have to pay for it.
Right. And then another fundamental problem is the rise in medical costs to begin with, because there's a steady trend of medical treatments and drugs just going up in price, and that should um, influence how insurance companies make their decisions as well.
Well, you bring up a really important point, and the really important point here for everybody,
Right.
irregardless of political persuasion, is this. When Medicare came in, and then later issues with changes to Medicare, which has been modified about 11 times, but
Mm-hmm.
then changes to Medicare and introduction of Medicare with managed care.
Mm-hmm.
The focus of healthcare changed from the hospital, where you might go once and have a healthcare problem, to ambulatory care, where you were going to be dealt with in a prevention or a treatment regimen on a daily, weekly, monthly, yearly basis.
Right.
And at the time, the cost of what was going on was expensive, but still potentially affordable. If it wasn't affordable and people couldn't afford it, then they got some sort of special aid from the government, either a state and or federal.
Okay.
But ambulatory care was the focus. Today, it's still ambulatory care, and people are still being treated in ambulatory care. But now the argument is that it is expensive, but in many cases, it's not affordable. When we're dealing with moving from the hospital, which you may go to once, have a high charge, which is how insurance was originally set up, and you would have it one time, then that would be something that people would be concerned about, and clearly you'd have to pay that off. But now, in new drugs, new genetic testing, new laboratory tests, etc., the costs are becoming so prohibitive that we've moved from expensive to not affordable.
Right.
Drugs, for example, that may treat certain conditions can cost upwards of $85,000, $250,000 a year, and this goes on year after year after year. So it's not a one-time thing. Well, if you look at that, then you have a problem with affordability, and how are you going to address that? The affordability problem is facing us today. It'll face us forever.
Right.
And we have to address that, even if government gets involved in dealing with managing prescription costs, which it's doing in every other country all over the world. These drugs are still expensive, and governments are still trying to figure out how to deal with it. So it's not a matter that, well, government steps in, negotiates for the cost of the drug, and the problem goes away. The problem is still there. It's just perhaps a little bit less than what it was, but it's still not affordable.
Right.
So we're dealing with ambulatory care that goes on all the time, that it's not affordable, and how are you going to deal with those costs? And those costs are the issue of what's happening in the world, and they're not just predicated on hospital costs, they're not just predicated on doctor costs, they are not just predicated on drug costs or pharmacy costs, it's everything. And now you have to address it, including all the companion diagnostic products and everything else. That's a huge issue.
Yeah.
To address.
Yeah, we can go more in depth on that, but we're gonna move along here. And also, why do other countries such as Canada and most of Europe and several other countries, why have they adopted the belief that it should be a right of all citizens to have health care. And how is it working for them?
Well, in a general statement, countries have made the decision that people who don't have health care
Mm-hmm.
cost more economically, societally, and don't produce um, contributions to the general welfare of everybody because they're not well, therefore they can't work, or
Mm-hmm.
they are not well and they can't work as well as they could,
Mm-hmm.
and so they're not uh, collaborating and including themselves in the general population. So as a general statement, and it's different, it's slightly different in all of the countries, but still the same argument, that they have decided that as a right, if people are healthy, they contribute more to the economic stability of the country. They contribute more with regard to new innovations. They
Mm-hmm.
contribute more as general working people. And societally, society is healthier and happier when it's well versus not being well and complaining that I'm not well all the time. That's
Right.
their decision.
Makes sense.
What's
Yeah.
interesting, and I think the point that you're really bringing up, Alex, is that if this is a right, how come everybody isn't yelling that I can't have access to care?
Mm-hmm.
Takes me several months to get to a doctor. Takes me several months to get surgery or an X-ray or whatever.
Right.
And why aren't they all up in arms yelling and screaming about taxes?
Yeah.
I mean, no matter where you are on the political divide, you ask the question, well, how come they're not all yelling about it? And the answer is that on one level, people are very satisfied with healthcare. They may not get it on the next day. I mean, if it's really urgent and emergent, then they get it on the next day.
Right.
But if it isn't, then they are settled into the fact that it's going to take a while in order to get that care.
Or
And,
maybe not as many people need it as
or
much.
maybe not
Because
as
they're
many
already
people need it.
taken care of.
Absolutely.
Yeah.
And in some cases, like China, it was a societal thing where people had the care. They went to the doctor, and frankly, it was a societal thing. You sat around and talked to everybody
Mm-hmm.
versus doing it.
Right.
When they took that away, then what happened is that utilization went down dramatically because people didn't need the societal thing, but they did have an opportunity to save money, and that became a huge issue. And it's true in every other country and what goes on. So in that regard, everybody sees it as important. I guess the other fundamental thing that everybody looks at is we've talked about care, and we've talked about how much healthcare costs. No question about it. It's expensive.
Right.
And there are things that have to be done in order to fix that. But it's also true that there's been enormous improvements and outcomes in that care. So while we've talked about, for example, that people are not doing as well as their parents, or my sons might not be doing as well as I am with their incomes and what they get, but in fact, for the same amount of money that they pay, they get a greater outcome. If you look at the drugs, stomach drugs that have come through with PPIs and drugs for acid reflux, that took away all the surgeries of what happened, and now it's drugs that are being treated on a medical ambulatory side. If you look at statins and what has gone on to treat hyperlipidemia, that has cut down significantly on the amount of heart surgery kind of problems. It has created other kind of surgeries, no doubt,
Right.
and more people that use them. But these are tremendous boons to what goes on, and that's just two of them. I haven't even talked about all the cancer treatments where we've done that have improved enormously, treatments for CLL or chronic lymphocytic leukemia for kids, and a host of things. So there have been those improvements. But as healthcare people, we always have to be pretty optimistic, because one way or another, whether you get the money, whether you don't get the money, whether you get the care, whether you don't get the care, somebody's figuring out another way in order to help people to get it. So we have to be optimistic, because at the end of the day, there's always another solution, and people figure it out, whether they're in China, India, South Africa, United States, Canada, Europe, or whatever. Bottom line is people figure it out and come up with new solutions.
Right. Well, I guess you can take away what you want from here. We covered both sides. We covered whether it should be a right or a privilege and what would it mean. You are free to come up with your own decision. If you have any comments or questions, you can feel free to leave the comment below. And yeah, I mean, I was trying to figure out a closing way to say it, but you covered it pretty good.
Uh-oh.
Yeah,
I think at
yeah,
the
it's
end of the
a
day, we're healthcare people. We
uh-huh,
have to take whatever we receive.
right.
Whether we like it or whether we don't like it, we still have to figure out what we do. What is really a problem today in all the debates is that hospitals, health plans, doctors, pharmacists, nurses are not included in the debates.
Yeah.
So the people who really have to deal with all of this have things that they don't agree, but there isn't a common discussion and debate about things that are very complicated and
Mm-hmm.
difficult to solve. But at the end of the day, when people begin to make decisions that are outside of what goes on and the people that are actually doing it, then what happens is things change, and then people start to manipulate it in order to try and make it work for them, and that just leads to more complications and more strife. So at
Yeah.
the end of the day, what we need to be able to do is to be able to stand up and have rational discussions about all of this. Nobody gets everything they want. Nobody gets everything that they're in favor of, but it really doesn't matter. Bottom
Mm-hmm.
line is you need to get all the people who know something and put them together about it, rather than having these discussions and decisions where the people who know, the people who do, are not included in that discussion. That is a problem.
Yeah, it's a huge problem. And well, like I said, that's all we have for today. And then we'll get together next week and cover a brand new topic for you. Please feel free to visit propharmaconsultants.com. We have a free information page. It's called RxInfoX, as well as articles written by Dr. Stern in the Pharmacy Benefit News. And we will see you next week.